Hello guys, welcome back. In today's video, I'll be discussing about the menstrual cycle. If you are a woman and you want to learn more about your menstrual cycle, please come closer. This video is for you. What is menstrual cycle? What do I understand by this word menstrual cycle? Menstrual cycle means the changes that occurs in a woman's reproductive organ during her reproductive age. That is when she is in the childbearing age. It doesn't happen during menopause or after menopause. So this menstrual cycle happens when a woman is still in her childbearing age. So, how do my menstrual cycle affect me as a woman and affect my health? Firstly, we are going to discuss about the reproductive health, how my menstrual cycle affects my reproductive health. Talking about the reproductive health, how does the menstrual cycle affect the reproductive health? First and foremost, it gives you insight on the regularities and abnormality of the menstrual cycle. Once you start noticing changes that is not normal with your menstrual cycle, this gives you insight to seek medical attention on time. Another point is fertility awareness. Menstrual cycle gives you more insight to know your fertile days and the days in which you are not fertile. This information is very, very important for people trying to conceive. Another point is hormonal balance. Knowledge of menstrual cycle helps you as a woman to identify any fluctuation in the hormone. This fluctuation can be as a result of certain conditions such as PCOS, in which the menstrual cycle or the menses becomes irregular, and this will be very difficult for you to identify your ovulation period or your most fertile days during trying to conceive period. Another point is it helps you to identify early those conditions that affect menstrual cycle, such as PCOS, ovarian cyst, endometriosis, fibroid, in which you notice that intensity of your menstrual flow increases or decrease, or the intensity of premenstrual symptoms increases or decreases. That is to say that once you notice that you have been having a lighter period and suddenly your period becomes more heavier, that should give you a concern to seek medical help. In conditions such as fibroid, people notice that their cycle becomes more longer. You see people bleeding for 2 weeks, which is abnormal. So in this case, menstrual cycle gives you more insight on how to go about your body, how to have body literacy. It's called body literacy. You know about yourself, you have more knowledge about your reproductive health, and this gives you more stability in making decision about your reproductive health. What am I saying in essence? The knowledge of menstrual cycle gives you more insight to know your reproductive health, to know changes that occur within your reproductive health. Your contraception, it helps you to understand how more knowledge on contraception and also your general well-being as a woman. How can I be able to track my period? How can I be able to track my menstrual cycle? Let's discuss that. The first method we are about to discuss is the calendar method. In this calendar method, you log on the first day of your menstrual cycle by writing it on the calendar, assuming that your menstrual cycle started on 6th of October. That is the first day you saw your period. That day means the first day of your menstrual cycle. You start from counting on that day. Then the next 14 days in that length means your ovulation period. So these things helps you to know when you are free and when you are not free for those trying to conceive. Another point is also help you, this calendar method also helps you to know your cycle length, in the sense that some people don't know their cycle length. You ask them, what is your cycle length? They won't know whether is it 28 days, is it 25 days, is it 26 days, or even 30 days. Some people don't know that. So this calendar method or app method, logging your first day of your menstrual cycle on a app, helps you to know the length of your menstrual cycle. It helps you to know whether you are having 28 days cycle length, or whether am I having the 25 days cycle length. This helps you as a woman to track down when you are really ovulating. All right, another method of tracking your menstrual cycle is by using the basal body temperature. Some people detect changes in body temperature during ovulation. So some people have learned the method of using their body temperature, and that is when they notice at a point that there is an elevation in their body temperature. This helps them to know that, hey, this is my ovulation period, or the heat period. Sure, you understand. So this method also helps you to track down your menstrual. Another way in which you can track down your menstrual cycle is by using the cervical mucus method. In this method, women use their cervical mucus discharge, that is discharge coming out from their vagina, to note when they are ovulating. So, in some point in the menstrual cycle, women notice increase in vaginal discharge, and this vaginal discharge is mostly slimy and water-like in nature. It doesn't have color. So, this type of discharge is considered as ovulation. The discharge, you will touch it, it's slimy. It's slimy. That type of discharge is known as ovulation discharge. So, you use it to know that you are on your ovulation. And when the discharge becomes thick and sticky, you know that your ovulation is actually over. Another method is using the ovulation predictor kit. It comes in form of this pregnancy kit stuff. You use it to dip it inside your urine, and if it marks two line, you know that you are ovulating. Right. Another method used to pinpoint the menstrual cycle is by detecting ovulation pain. Actually, this method is not that effective, but most women notice during ovulation, they notice some abdominal pain, tingling sensation in their ovary area, on their lower abdominal area. They notice pain in that area. So they use it to know that they are ovulating, but it's not actually effective, because there are some certain conditions that can pose that you will have lower abdominal pain, such as in a case where you have ovarian cyst. You see, you cannot even use that pain to identify that you are ovulating. In a in a in a time you have all these fibroids and other, you see you're having constant lower abdominal pain. So you cannot necessarily use it to identify your menstrual cycle. So in essence, the most effective method you can use is the calendar method. Yes, it's very, very effective. You can use it to track down the length and the regularity of your cycle. One thing I want to advise is, why doing all these methods, please try to be patient with it. Maybe from your 2 or 3 cycles, you start seeing the regularity and the length of your menstrual cycle. You cannot just start. Maybe some people, the problem that they will encounter is that they start, this one runs at for 30 days, the next one runs at 28 days. So they said that this thing is not important. No, no, continue. You will see at some point it will start giving you the regularity of your cycle. Maybe from fourth cycle, you start getting the regularity and the intensity, the way is that the menstrual cycle actually goes. You will be able to know whether you are having 25 days cycle, 26 days, 27, 28, 29, or even 30 days cycle. So be patient, be patient while you do all this method. Then always seek medical advice. If you find anything funny in your menstrual cycle, maybe you are having too much pain, too much excessive bleeding, excessive premenstrual symptoms like bloating, cramps, or every now and then. So it's best to seek medical advice when you experience such